Hey guys, we back. This is Heath and Laura here, our little weekly medical vlog on what we're seeing here locally with this COVID-19. We were asked last week by the members of the church family to answer some questions, kind of go over some things, what we're seeing, what we're doing, what we can do to make others comfortable. And we answered those and had an excellent response. And we've received some more questions. They've asked if we would answer those as well. So we're going to try to answer those. But it was brought to our attention that last time we forgot to introduce ourselves. Obviously, it's kind of reached out further than just our little church home and local community. So Heath and Laura Daniel, we're both currently nurse practitioners. My background is more emergency care. Started life as a paramedic. Rode on both an ambulance and flew with the Alabama Lifesaver helicopters for many years. Went back through nursing school. Worked all of my time in emergency rooms locally, primarily Wetumpka, Lake Martin. Went back to nurse practitioner school at Samford University. Got nurse practitioner of family medicine. Got out, was working in the ERs and urgent cares, and then went back and got the emergency nurse practitioner addition to that, and have been primarily in the emergency rooms since that time.
Also have been a family nurse practitioner for 11 years, and I was a nurse for 5.5 years before that, and I went to Troy University. Also did the family medicine board certification and work at Lake Martin Family Medicine and in the family medicine department, rural health clinic, and also do some hospice work. On Fridays I see hospice patients, and then we are both currently working at Lake Martin Community Hospital on the COVID floor during the week as well.
Yeah, so we're going to jump right into these questions. You want to take number one?
Sure. So the very first question we were asked this week was wanting a weekly update of what was happening in our county. And we get all of our information from the Alabama Department of Public Health, which is the website anyone can go to. Anyone can get that information. It is updated daily. And we checked it earlier today, and we have a total of 430 cases in Tallapoosa County, 64 deaths, and we were also asked how many beds are available at this point. And at Lake Martin Community Hospital, we keep anywhere between 18 and 22 COVID positive patients at any time. We do have some regular beds available for regular patients as well that are separate from our COVIDs, but we have about 15 to 20 beds that are available in addition to those beds.
Yeah. And the second question was procedures, like if somebody needs a ventilator. Well, at Lake Martin Community Hospital, being a rural health clinic, we don't have ventilators there, nor the specialists like the respiratory therapists that usually run those. So if we have a patient who is in severe respiratory distress, we believe their breathing is going to decline to the point that they need a ventilator. First and foremost, we certainly take care of the patient. We have other things that we do to help a person breathe, even without having a ventilator. So if we do need this patient to go, say, to an ICU, they need a ventilator, they need some specialty care. Some of our local hospitals around East Alabama Medical Center, Russell Medical Center, Elmore Community Hospital, which is our sister hospital, are generally ones we transfer to fairly regularly. So on our end, the patient needs a vent, we would call. The receiving facility would have to have both a provider and a room available to be able to accept that patient. So it's kind of a provider-to-provider discussion about the patient. If that provider feels comfortable, they can take the patient, take care of the patient, and they have a room to put that patient in. We would transfer those. We have our own in-house EMS, Tallapoosa EMS. So they would take the patient from Lake Martin Community Hospital and certainly take care of their breathing en route until they get to that receiving facility and hand that care over to that provider. So that's how that works when we need to get somebody somewhere that has a vent or an ICU.
Question 3. Discuss the possible infection differences between two people wearing masks or just one or neither wearing masks, and masks such as home sewn masks, surgical masks, and 95 masks.
Yeah, that's a hard question because there's no true data on that. We're all about evidence-based, peer-reviewed data, and nothing that I can find anywhere has that. I mean, this is a new corona. It's a novel virus. It's a new virus. Even old research from previous viruses, the flus, there was never any research, real true research done on the mask, and the likelihood of whether it's going to hurt you by being more contaminated or help you by preventing contamination. Most current research that we can find shows that any type of mask, it can be a cloth mask, it can be a surgical mask, will help prevent infection from a patient who is asymptomatic or pre-symptomatic. The way that works, if the patient has a cloth mask or some mask over the mouth and nose, and I have the coronavirus, but maybe I'm not having symptoms, we know I can still spread that virus even being asymptomatic. But if I had that mask on and I'm in a large place, a grocery store, convenience store, and I cough or sneeze, it's going to contain a lot of those droplets in my mask. Rather than with no mask, it spreads those large droplets, respiratory droplets, all over, which kind of float in the air and linger and kind of meander around. We know that a mask on that person can reduce that spread. So yes, masks can help reduce the incidence of coronavirus spread, but the only research shows that if it's being used by that positive asymptomatic or pre-symptomatic patient. The N95 mask, or what we wear in the hospital, it kind of needs to be reserved for those doing medical procedures. We're having a certainly difficult time getting those, I think, nationwide. They do stop the viral particles, most all of them. Surgical mask, cloth mask do not really stop the viral particles. The viruses are very small, but they do help inhibit or prohibit large volumes of respiratory droplets coming out, because it's been proven. I mean, you talk loudly, respiratory droplets are coming out. You sneeze or cough, obviously. So we believe in masks. We believe if we go into a heavy populated area, congested area, we'll certainly wear them. Makes us feel better, but still, it doesn't replace the hand washing, the social distancing kind of thing.
Yes. Then question 4 was, what is our recommendation for scheduling annual exams, wellness checkups, elective surgeries, or dentist visits? And we never stopped in my office with well checks or routine yearly exams. We had a lot of people who did not come, of course, in the beginning, because we tested and we still test for COVID. So we have sick patients as well patients there. We really try to separate those out, so to quarantine those away from each other. And we are doing well visits. We are doing routine exams every day. And if we have a sick patient, then we usually try to mask them and either let them wait in the car or let them wait in another area. We deep clean between all of our patients, so
Absolutely.
we are completely trying to, not have anyone come in contact with anything that they don't need to. And as well as dentist offices, I've had my 6-month cleaning. I had it last week, and they as well, my dentist office was deep cleaning, and they're protected with every patient. I had to wait in the car until they were ready for me. Same way with what we're doing as well. We have the option to for you to wait in your car, and we are still doing some car visits as long as we can. And we are doing insurance departments, our insurance companies are allowing us to do telemedicine visits as well. So we have an app that we use, and we can do a face-to-face visit on that app with a patient, and they actually don't have to come into the office for that. And as far as elective procedures, I know anyone that they did stop those for a while, and that was detrimental to a lot of facilities. but they have started back doing some of those procedures. Most providers that I know, most surgeons that are doing those, are testing those patients before they do the procedure. So they are receiving a COVID test before they're done or doing the procedure. But as far as we're concerned, we are doing well visits. I think most places are. I don't think I know of any offices that are not doing those annual visits at this point. So I feel safe. I feel like it is okay to do those. We are trying to take extra precautions for those patients who are well to keep them well. Would wear a mask. We provide masks to our patients who request them, or if they are sick, we do require that. Well, we do like for you to have one of those on. And then in our waiting room, we have our spacing. We're at 6 feet, and so we are really trying to take precautions. But I think it is fine for you to go ahead with those visits if it's something that you're ready to do.
Yep, I agree. Next question is, are most infected patients that we're seeing from nursing homes? Well, Tallapoosa County has a large nursing home population, a large number of residents in nursing homes, numerous nursing homes around the county. Unfortunately, it's really hard to get that specific data for the county as far as nursing home patients in the county. You know, we see what everybody else sees, what they publish in the Outlook, Bill Nichols Veterans Home, Chapman's Nursing Home, several others. They've all, or many of them have had positives. I got the number from the state, from the Alabama Department of Public Health website. As far as nursing home patients infected in the state, statewide, it's 1,682. Now, the total number of infections in the state currently is 17,849. So less than 10% of the infected population is from nursing homes. Now, two other statistics that go with that, if you add that to the 1,682 nursing home residents, nursing home employees, there's 1,019 currently or positive coronavirus. And then if you add healthcare workers through the state, there's over 2,000. It's 2,221 was the exact number as of today, bringing that grand total close to 5,000. So almost a third of the entire statewide population that's positive for the corona is nursing home residents, nursing home employees, or medical workers. So tremendous number, but still it's less than 2/3 of the whole population. So there's a lot of people who are just out there, general public, that make up the most corona positive patients in the state.
Yes. The next question is, what were your youngest patients that you have seen COVID positive? And we discussed that earlier. I don't think we talked about that before, but I had a mid-20s that was positive, and I have had several of those. And I think that's
early 20s.
Yes. As well. So we've not had any children that we have really seen that were positive, but our youngest are mid-20s that we have both had positive.
Yep.
And the next question is, how worried are you about infecting your family? And in the beginning, it was really tough. We were both very scared. We had nights where we lost it and broke down and were just very concerned. It was very scary in the beginning, but at this point we are better. We're better with that. I think that we have a routine that we do every day. We, completely take off our work clothes and shower before we come into our living space in our house. We have a downstairs bathroom and shower where we are able to contain all of our contaminated clothing, shoes, everything down there. And the kids know that we do not socialize with them until we have decontaminated ourselves. And that was very tough in the beginning, but we all feel better about that. And so far we've been successful with that. And we're very strict about what we do and how we do it, and we will call each other out in a heartbeat if we don't do the things correctly that we should. So it's better. We are much better with that. And is there still worry? Yes, there's still worry because we are both in it every day with positive patients. So there's still that chance that we could definitely spread it. But we have been real particular about our family. Our kids stay with my mom during the week, and we try to keep them when we're both working out of our space until we're decontaminated. We have not seen Heath's mom in months. We're really, our circle's small, and so we've tried to just be really, really careful about that because it's possible. And but our worry's better. We are better, I guess, to answer that question.
Yeah. Last question was any new recommendations? Well, from last week, no new recommendations. Still the same. Hand washing is still number one. Always has been, always will be, and frequent hand washing. Hand sanitizer is great when you do not have the ability to use soap and water. Soap and water is the best, certainly. But hand sanitizer, washing your hands, being smart. We know that these asymptomatic or pre-symptomatic patients can transmit it. So you have no idea who may be positive. So avoid being in real close contact with others outside of your group. Somebody coughing or sneezing, obviously, avoid those. If you're the one coughing or sneezing, cover your cough, cover your sneeze, wash your hands. If you wear a mask, don't be touching your mask, pulling it down to do things and putting it back up because, you're contaminating yourself or it even more every time you touch your face. We also know that, this thing travels through, respiratory droplets, the coughing, the sneezing. If they land on your nose, your mouth, even in your eyes, it's possible to get it. So it goes back really strongly to that social distancing, just maintaining a little bit of space. We've cut out a whole lot of hugging and, shaking hands and fist bumps that we used to do. Here in the South, we love hugging. But that slowed down tremendously. So, it's a wave from over here. How you doing? We can talk across the room, no problem. Wash your hands and just be mindful of what's going on around you. You touch things that lots of people touch, doorknobs, carts, buggies, light switches. That's the time to wash your hands again. So, but no new recommendations. If there are any that come out through the CDC, we try to use these I guess I don't know if I want to call them corporations, but the ones who have the best data, the ones that truly generally try to be non-biased and give us the best information. That's what we want to share with you. We don't want to just get into opinions on he said, she said. We want to give you real data, what we see here locally. And if you have any questions, certainly ask. We'll be glad to answer anything else we can.
Yes, we hope this is helpful. We got a lot of feedback last week, and that's why we're back this week. And so we hope everyone can learn something. We learn every day. And like I said, we're not experts, but we are hopefully putting this information out there to help everyone and to know what's going on in our community, and that people can take this and use this in their own family. And send us questions, and we hope we can continue to help people out and get the information out there for people to know.
Yep. Until next week.
Take care.
See ya.